Hello, this is Andrew Wolf, and in this video I'm going to talk about determinants of blood pressure. Now, the first thing that is important to understand with determinants of blood pressure, sort of understanding the physics of the pressure of liquids in a tube. Now, the best way to understand this is to have a basic understanding of Poisson's law. Now, I don't want you to get intimidated by this formula, and we're going to break it down and make it very simple. But this is the formula that is Poisson's law. Now, F stands for flow, and in this example, we're going to be talking specifically about blood flow. So F is blood flow. Now, blood flow equals the change in pressure, in this case blood pressure, times the radius of the vessel. So the R actually times the radius to the fourth power. That's very important to recognize, and we'll explain why in a minute. Radius of the vessel. Pi just stands for a constant, and we're not going to worry about that. And we're also not going to worry about the 8, and just sort of balances the concept. This stands for the viscosity of blood, and L stands for length. Now, we're just going to do a little algebra. Actually, I'll spare you all the steps in the algebra, but you can do this yourself if you wish. But basically, what this correlates to, or once you do the algebra, what we have is change in blood pressure equals the flow times the length of the vessel times the viscosity divided by the radius of the vessel to the fourth power. Okay? So why is that important? Well, if you wanted to go through the trouble, you could calculate someone's blood pressure that way if you knew the length of the total length of the vasculature, the amount of blood flow, which is going to equal cardiac output, right? And the viscosity of the blood. And what's the viscosity of the blood? Well, viscosity mathematically equals the amount of force that it takes to pump a fluid. So if you have a viscosity of 1 equals water, blood takes 3 times as much force to pump than water, so blood has a viscosity of 3. Whoops, that wasn't a very good 3. Of 3. Now, obviously, if you have a very low hematocrit or decreased proteins in your serum, this could be a little bit lower. So that is going to have a significant effect on blood pressure if it is dropped enough. And then we have divided by, this is all divided by the radius to the fourth power. So what does this all mean clinically? Okay, well, basically blood pressure is directly proportional to flow. So it's directly proportional to flow on a one-to-one basis. So if you increase flow, if you increase cardiac output from 4 to 8, if you have a 100% increase in cardiac output, you are going to have an equivalent increase in blood pressure. Okay. Now, length, same thing is true. Now, when we talk about the pulmonary system, we're going to talk about how the pulmonary system has a much shorter length in its vasculature than the systemic circulation, and a lot of that just has to do with the pulmonary circulation being confined to the short space of the lungs, whereas the systemic circulation includes a very long body with lots of organs in it. So anyways, that's significant to know about, that if you have decreased length, you're going to have decreased blood pressure. And this is one component of why the pulmonary system is a low pressure system. Okay, so that's length. And viscosity also, blood pressure. Let me use different colors here. Blood pressure is directly correlated with viscosity. So if you decrease viscosity from a normal viscosity of 3 to 2.5, you're going to have a equivalent decrease in blood pressure. But what's really interesting to note here is blood pressure is inversely related to the radius to the fourth power. So inversely related to the radius to the fourth power. And what this means is if you increase the radius by maybe a factor of 2, so if you have a vessel that is 1 centimeter in diameter, and you increase it from 1 to 2, then you are going to increase blood pressure to, actually you are going to decrease blood pressure because it's inversely related. You are going to decrease blood pressure by 2 to the fourth power. Now, it may be a while since you've done your high school math, so 2 to the fourth power means 2 times 2 times 2 times 2, 4 times, and that equals 16. So by increasing a blood vessel from 1 centimeter to 2 centimeters, if you've doubled the diameter of a blood vessel, you will decrease blood pressure by a factor of 16. So this is really important to understand. All the other factors in this equation, blood flow, vessel length, and viscosity, are directly proportional on a one-to-one basis, whereas radius is inversely proportional to a power of 4. So the radius of the blood vessel is the factor that has the most consequence for changes in blood pressure. Okay, so how does the body control blood pressure? Well, the main way that it controls blood pressure is by changing vessel diameter, or by changing the vessel radius. Changing radius. So, in our body, we have, in our vasomotor center, it's part of our sympathetic nervous system. This is the main place that we control our blood pressure. Now, this sends out information via the sympathetic nerves. Remember, we've got the sympathetic ganglion down here that run alongside the spinal cord, and we send out information to arteries and arterioles around the body. And the arteries and arterioles all have a muscular layer that respond to stimulus by the sympathetic nervous system. So remember, when we were talking about the nervous system, and we talked about the sympathetic nervous system. The sympathetic nervous system is always cranking out some level of norepinephrine. So the motor neurons from the vasomotor center always are putting out a certain amount. And let's call it 50 microns per minute or something. Now, this doesn't necessarily mean anything, but this would be called sympathetic tone. And this is what the body is going to be cranking out at any given time. And this keeps the blood vessels sort of constricted, sort of in the middle of its range. So, if the range of this blood vessel, it can constrict down to, 5 micrometers, and it can dilate up to 20 micrometers, then if with a vasomotor tone somewhere in the middle, it's going to be hanging out at around 12 micrometers, right? So the body can do two things. It can either decrease that tone, which would relate, if we decrease this to 30, then we are going to relax the muscles and dilate this vessel maybe to 18, right? So we're going to increase from 12 to 18 in diameter. Now this change is about a 50% change, and 50%, a 50% dilation of a vessel is going to dramatically decrease blood pressure. Remember, it's an inverse relationship. In fact, if you do the math, if you do 1.5 to the fourth power, it comes out to be about a factor of 5. So just a simple 50% increase in a vessel size is going to decrease blood pressure by a factor of 5. So you can see, the vessel needs to constrict or dilate a very small percentage to have dramatic effects on blood pressure. Anyways, so if the blood pressure the sympathetic nervous system can either increase or decrease the amount of epinephrine and norepinephrine that it is releasing at the local level on the vessels, and cause them to either constrict down towards their minimal size or dilate up to its maximal size. Now, if the sympathetic nervous system is the main way the body controls this, but locally we also have a lot of tissue factors, and the immune system also has chemicals that can control it, like histamine. And I know we talked about an example of vascular collapse. If you have a histamine release throughout the body with an anaphylactic reaction, you basically, what happens is histamine causes the vessels to dilate significantly by 50% or more, and blood pressure plummets. So you can end up with a blood pressure that is a third or a fifth normal, and you can end up with a patient that codes. Okay, now the second way that the body controls blood pressure is by controlling cardiac output, by increasing stroke volume or increasing heart rate. And again, the main way that it does this is through the sympathetic nervous system. This excuse me. Remember, when the sympathetic nervous system releases epinephrine and norepinephrine, it stimulates the beta-1 receptors in the heart, and this stimulates a positive inotropic response that increases the force of contractility. It produces a positive dromotropic response, and that just increases the speed of conduction of action potentials, and a positive chronotropic response. Now, these two are going to have the most dramatic effect. The inotropic response is going to increase stroke volume by having a more forceful contraction. So you're going to go from an EF of 65% to an EF of 80%. And a positive chronotropic response is going to increase heart rate, and both are going to work together to increase cardiac output. Now remember, cardiac output is equal to blood flow, and it has a 1-to-1 relationship with blood pressure. So if you increase cardiac output by 50%, you're going to increase blood pressure by 50%. So an increase of 50% cardiac output equals an increase of 50% of blood pressure. Okay, so those are the major determinants of blood pressure. Please take a moment to give me feedback by giving me a thumbs up or a thumbs down below, and also feel free to click on this link if you'd like to subscribe to my channel so you have easier access to the videos. Thank you very much. In this example, we're going to be talking specifically about blood flow. So F is blood flow. Now, blood flow equals the change in pressure, in this case blood pressure, times the radius of the vessel. So the R actually times the radius to the fourth power. That's very important to recognize, and we'll explain why in a minute. Radius of the vessel. Pi just stands for a constant, and we're not going to worry about that. And we're also not going to worry about the 8, and just sort of balances the concept. This stands for the viscosity. Best way to understand this is to have a basic understanding of Poisson's law. Now, I don't want you to get intimidated by this formula, and we're going to break it down and make it very simple. So, but this is the formula that is Poisson's law. Now, F stands for flow, and in this, hello, this is Andrew Wolf, and in this video I'm going to talk about determinants of blood pressure. Now, the first thing that is important to understand with determinants of blood pressure, sort of understanding the physics of the pressure of liquids in a tube. Now, the